I'm Professor Georgina Odaipo from the Department of Virology, and today we shall be discussing transmission, prevention, and control of HIV, human immunodeficiency virus. Here is our learning objective. At the end of this class, you should be able to know different modes of transmission of HIV, the various ways to prevent the spread of the virus, and the role youths play in the prevention and control of HIV. So HIV is the world's most devastating epidemic. Millions, over 30 million of people have died, and currently we have over 38 million people infected. So when you talk of most devastating epidemic, you can understand with that number of people being infected and affected, because it's not only about the people who are infected, there are also people who are affected. The orphans whose parents died of AIDS, the family members who go through all sorts of challenges to be able to look after their loved ones who are infected. So it's really a devastating epidemic. Physical and social, psychological, as well as economic effects, affects individuals, affects the community, affects a nation, and of course affecting the whole world. Since 1981, when the virus was first or the epidemic started, the world has been on HIV till today, over 40 years now. So it affects individuals, families, society, and to top it up, there's no vaccine. For most of the viral infections that have been controlled thus far, it's been through the use of vaccines. And vaccines are known to prepare the individual's immune system such that when these agents come in, they'll be able to attack and destroy. But HIV, it has been very difficult because of what we discussed in our previous class, which is the heterogenic nature of the virus. The virus changes, mutates so rapidly. So if you develop a vaccine against one type or one strain, it may actually not work for the other strains, because an individual can be infected by different strains. So if you can infect the immune system or the immune response that was generated by the initial virus, it's not enough to protect you against another one. So it's highly challenging. And therefore, the main mode of prevention will be by ensuring that we protect ourselves and do things that will protect us and not get involved in things that will expose us. So prevention of HIV is a reliable and secure way of protecting against the infection. There are three major modes of transmission: sexual contacts, from mother to child, and then from blood, and blood products. So when we talk of sexual transmission, we're talking of both heterosexual and homosexual. Heterosexual is a sexual intercourse between a male and a female, while homosexual intercourse is between a male and a male, or could even be female to female. We use some different objects. So sexual transmission will be influenced by host infectiousness. That's what we call host infectiousness. That's somebody who is infected. How infectious is that person? How easily can that person transmit the infection to another? That's a host infectiousness. And this we have to do with, one, the viral load. If the virus circulating in that individual's system is very high, then the chance of transmitting it will also be high. So it means the person is highly infectious. other STIs, especially presence of other STIs, especially the ones that cause ulcer, So the fact that you have other STIs, there is also the higher chance of you transmitting it. The ones that are ulcerated, you will have a lot of cells around that ulcerated area, and so it's easily transmitted to anybody you're having sexual contact with. And then for some people, they prefer or they love having sex during menstruation. And we also know that during menstruation, the number of cells around the female genital is high. So both ways, whether it's a male that is infected, it's easier for the woman to become infected because you have a lot of cells around there. If it's a woman that is infected, of course, the infected cells are around there and there are higher chance of infecting the man. Then we can also be influenced by viral infectivity. How infective is a virus? Some strains of viruses are known to be highly virulent. They replicate very fast and they can be transmitted fast as well. In our other class, we talked of HIV-1 and HIV-2, and we saw that HIV-1 is highly transmissible. The rate of transmission of HIV-1 is 3-fold higher than that of HIV-2. So how virulent a virus is will also determine. And also even in HIV subtypes, HIV-1 subtype C is known to be transmitted faster than the subtype A. So the infectivity of the virus will also determine whether you become infected or not. You have two individuals exposed to the virus, one become infected, one doesn't. Like a couple of factors. Some of this we've mentioned and some we don't know. There's also what we call the host susceptibility. That is the person who is not infected. How susceptible is that person? The presence of other STIs is also known to play a role in that, and sex during menstruation also. Then somebody with multiple sexual partner, for instance, the more sexual partner you have, the higher the chance for you to become exposed to somebody who is infected. So these are some of the reasons. Like I said, it's not everything that is known, but these are some of the things that will contribute to transmission during heterosexual. Also, to go back on that heterosexual, we had a study that was done some years. That was before the introduction of antiretroviral therapy. And we looked at couple, husband and wife, who has been married for a minimum of 2 years and one of them being infected. And we saw that it was just about 45% of the situation where we have both partners or the couple infected. In the other 55% is either the man or the woman. A lot of times the woman was positive when the man was negative. So it's not every sexual intercourse or sexual exposure that results into infection. That's why the emphasis is that you don't know, we really don't know everything that we need to know about the transmission of the virus yet. Then the mother-to-child transmission, it can take place while the baby is in utero during pregnancy, because there's a link between the maternal and the child. So that can occur there. It can also occur during delivery. During delivery, there's a lot of blood mixing of maternal and child, So most infections are known to take place during delivery when you have a vaginal delivery. And that was why at the early stage of the infection, it was people were cancelled to opt so that they could opt for cesarean section. Because during vaginal delivery, there's usually a lot of blood and higher chance of the baby getting the infection by passing through the birth canal. It takes a longer time to do that, and each second that is spent means more exposure for that baby to become infected. And for the ones who did not become infected during pregnancy or during delivery, they can also become infected during breastfeeding because the virus has been found in breast milk. So children can also become infected by taking breast milk. And the third is through contaminated blood and blood products, either through blood transfusion, or it could be semen, vaginal fluids, use of contaminated needle and syringes. At the early stage of the epidemic, many people became infected because, especially in rural communities, the same needle and syringe were used to inject so many people. So that's actually contributed in spreading the virus at the early stage of the epidemic. And then sharing of sharp objects like razor blade, or barbing instruments, and all of that. So that's why we must be very careful when you go to a barbing salon, when you go to do your manicure and pedicure. It's always good to use your own equipment if you can afford it. In a situation where you can't afford it, then you must insist that the barber or the hairdresser decontaminates whatever equipment they are going to use on you. So how is HIV not transmitted? It cannot be transmitted by casual contacts. When you talk of social kissing, it means just a peck on the cheek is not going to give you HIV. Talking with somebody who is HIV positive will not give you HIV. Sharing your cup or spoon, of course, hygiene. Under normal circumstances, you should wash a cup used by somebody else before you use it. That process is enough. Giving somebody a hug, smiling, dancing together, walking around together, is certainly not going to transmit the virus. So let's show love. Let's relate with people who are positive, who are HIV positive, so that they will feel loved. If they feel loved, then they will show back the love, and they will return the love by ensuring that they don't do things that will expose another person. Of course, there's been this question about insects. Mosquitoes can transmit malaria. Why can they not transmit HIV? Yes, for an insect to transmit a virus, the virus should be able to survive and multiply within that insect. So that's the situation of what happens in malaria. That's what happens with yellow fever. But in HIV, the virus will not survive in an insect because the cell that the virus is required to infect is not found there. So mosquito bites cannot transmit infection. Well, there are some myths that people have about transmission. I'm a virgin. Because I'm a virgin, I cannot have. That people do all sorts of things just to make sure they maintain their virginity, an intact vagina, so that when you eventually get married, you say, she was a virgin. But then they engage in some other sexual acts that also expose oral sex, for instance. A lot of people do oral sex so that you can acquire infection through that. Some people do anal sex. Anal sex is even more risky than vaginal sex because anus is, the muscles around the anus is close and tight. So in the process of having anal sex, there's usually a tear, and that becomes a very good source of either infecting the other person or acquiring the infection. So that somebody is a virgin is not a key that the person is not HIV positive or cannot acquire it. There are other routes. Some people say straight people, that is a men having sex with women, or when you are homosexual. Yeah, because the very first set of people to come down with AIDS were mainly homosexuals in the US. But we know that both men and women are exposed alike. So it doesn't matter whether you're a straight man or you're a crooked man, or a straight woman or a crooked woman. Whether you're gay or you're heterosexual, everyone is exposed. As long as you're having sex, you can be infected. Type of sex, whoever you are, is not a barrier. I'm safe because I'm in a monogamous relationship. Yes, you're always sure of yourself 24 hours. You can't be with your spouse or your partner 24 hours, so anything can happen. So it's not say, yes, I have one boyfriend, or I have one husband, one wife. That should go when his relationship is mutual. When the fidelity is mutual, in the each partner say, I will not do anything out of this union. That stands. That's the best. But in a situation where anyone goes out, then the risk comes in. So prevention. How do we prevent? Of course, once you know the ways of acquiring, then the mode of prevention is very clear. This is how you can get it. A way of not getting it is to avoid how you can get it. It's straightforward. This is not just about HIV. It's about every infectious disease. If you know an infection you get from food, contaminated food, you can't avoid food, but you can avoid contaminated food. So it's to ensure that you don't take contaminated food. But in this situation, we know, one, the virus is transmitted by sex. So the best thing will be to avoid sex. Yes, and that's what I'm saying to this class today, because I guess many of us are married. It's only an assumption, no? But I hope my assumption is correct. So it's to abstain from sex. When you abstain, then there's no fear, except through other modes. But once you abstain, then there's no fear. So either you abstain, or if you can't abstain, you do what you make sure that even when you engage in sex, you're not likely to become infected. So the whole IEC, that's information and education communication, doesn't get acquiring knowledge like what we are doing now. Information that is being passed to you through this GS 107 is to build you up so that you have information, and then you have a behavioral change communication, change your behavior, communicate that behavioral change to others, and then maintain a positive behavior. And secondary prevention will be to do diagnosis early. The key to any infection is to diagnose it on time. Diagnose it before so much harm is done. That's what we call early diagnosis. So when you do early diagnosis for HIV, you can also now bring in early intervention. And one of the interventions that is brought in is the treatment. So if you do a diagnosis and you're positive, then you can start treatment on time, and you can live your life as a normal as every other person. And then the tertiary is to minimize morbidity and mortality. Of course, that's part of what the treatment we do. When you are diagnosed, you go on treatment, then it will be able to minimize morbidity and mortality. So sexual transmission, we say once you know how it's transmitted, you know how to prevent. So preventing sexual transmission, there's what we call ABC of prevention of HIV. The A stands for abstinence. And this is a message for those who are yet to be married, that you abstain, If you don't get yourself, if you don't have sex, then there's no fear of acquiring infection by sex. The second one is B, which is be faithful, which is a message for those who are married. Be faithful to your partner, and this faithfulness has to be mutual. Be faithful to your sexual partner. And in a situation where you cannot abstain, you cannot be faithful, then there's a third option of use of condom. And what condom does is to provide a barrier between the two people having sex, so that if one person is infected, the chance of the virus getting into the other person is reduced by that barrier, especially in a situation where you're having casual sex. I know in a setting, the husband, it will be awkward for husband to get up and tell the wife we must use condom, or the wife to get up and say, tell your husband we must use condom. No. But when you are going to engage in casual sex, then you must use condom. Except for, of course, if your wife has a reason to suspect the husband, or the husband has a reason to suspect the wife, they can do that until they confirm that both of them are negative. So blood transfusion, you must screen your blood. Blood must be screened before they are transfused. And next to sexual transmission is blood transfusion is the second highest risk, because this is the mode of transmission that is 100%. If you have the virus in the blood, it's going to another person's bloodstream straight. And within that person's bloodstream, there are cells there waiting to be infected. So unlike heterosexual or sexual or mother-to-child transmission that is not 100%, blood transfusion is almost 100%. I just want to be scientifically correct by saying almost. It's 100%. Because the quantum of the virus within the blood that we are transmitting, that's the dose of the virus, and then the fact that the blood is going straight into the bloodstream to meet other cells that are ready that will be infected in the process. So it's very, very important that blood transfusion is done only when it is necessary. A lot of some hospitals may not mention, especially the ones that are money-oriented. They think if they now tell you, you need blood, everybody will start panicking and go and look for the money from wherever to pay. So there are some blood transfusions that are really not necessary. But we should only transfuse when it is absolutely, that is, without this blood, this person cannot survive. Otherwise, there's the risk of because even when you have already screened your blood, there's what you call the window period. The period during which an individual is infected, the virus level is very high, but the antibody, circulating antibody, is very low. So at that point, when you are doing a test, you will not be able to pick it. But then, if you transfuse such a blood, because the virus level is very high, the person you are transfusing the blood to will certainly become positive. So because of that slim chance that even when the blood has been screened, it can still be positive. There could even be a failure in terms of the tool that was used. We are talking of variability of the virus. It's possible that the test that is being used may not be detecting all the available strains. So there's a possibility that a blood could be screened and yet that blood is positive. So for that, blood transfusion should only be given when it is absolutely necessary. And then when it's necessary, then the blood must be screened. And must be screened with a highly sensitive assay. Remember, we talked about screening, diagnosis of HIV infection on top of the screening tools. Screening assays are supposed to be very, very sensitive. Currently, we have assays that can detect both antigen and antibody. Those are the kind of assays that are recommended for blood transfusion purposes. And it's our responsibility after this information we've acquired to ensure that wherever we find ourselves, or our relatives, or a friend, or a colleague, or a neighbor who needs blood, we should find out if that blood has been screened and if it was properly screened before the person is given. Remember, this course is one of the objectives of this course is to make us change agents that will go out there and make a change as far as HIV control is concerned. So use of sharp objects, do not share objects. That should be one of your motto. Never share sharp objects. Don't ask your friend, can I borrow your blade? For what? Can I use your comb? For what? Can I use your clipper? For what? So never you share objects. Can I use your needle? Most of us who are ladies, we sew our head, in the process of doing that, can actually get one infected. So never you share sharp objects, never. Needle, syringe, blade, knife, that is personal. Anything that is personal, no, don't share. And then prevention of mother to child transmission, that's PMTCT. P for prevention, M for mother, T for C, child transmission. So every childbearing age woman should be tested. So it's not when you are already pregnant that you know your status. If you know your status before you become pregnant, there are things to do to help you have a child who will be negative. You will see a doctor who will give you the necessary counseling for you to be. So that's why there is a need for every woman of a childbearing age to know their status. And remember that knowing your status is not a one-time for all thing. You are supposed to be doing your test every 6 months. Because as long as you are exposed, then you can acquire the infection at any point in time. So every childbearing age woman should know their status so that they can plan appropriately. No, it was at the beginning they would say when you are positive you can't have a child. No, that's not it. You can still have a child. Not only a child, you can have a child who is HIV negative. and you'll be able to nurse that child till the child is grown up. So things have changed with the antiretroviral therapy. A lot of the narrative of HIV infection has actually changed for the positive, but also there's also a negative. There's also a negative, which is something I didn't mention in my last class. Where you have those countries where you're having increase in new infection, because people are becoming complacent. Oh, there's drug, anything can happen, I'll take drug. That's the other side. But then that cannot overrule the good side of antiretroviral therapy. And then all pregnant women must also be tested early enough so that they can be placed on antiretroviral therapy, and so that they can have children who are free of HIV. So for abstinence, you have to say no and keep saying no. There's what we call peer pressure, and the more pressure that is on you, is hoping that you will give in with time. But just keep saying no. If you really mean no, then keep saying no as many times as it takes for you to say no. No, no, no to sex. And the pressure is there. It's not only to the female, it's also there for the male. Yes. There are also females that pressure males to have sex. So pressure is both ways, and we must learn to say no. They also have to practice what to say if someone pressures you. The worst thing that could happen to you is to be taken unawares. But if you really know that this is something that is possible, something that can happen, then you prepare yourself for it. Oh, if somebody approaches me for so this is what. So what you will say is already in your mind. You're not going to be thinking. Immediately the offer is made, you just give your answer, bam. And the person will know that this person is serious. So get out of a trouble situation by walking away and staying away. Use your body language. There's a way you will present yourself, and then people will say, oh, this person may be interested. It's what we call body language. Your body speaks. The way you look at people, the way we are not saying you should not be friendly. No, far from it. You should be friendly, but you should be firm as well. So let people know clearly. And when you speak clearly and confidently. And then there's that this saying, oh, everybody is doing it now, so why am I different? Oh, all my friends are having they have experience with this. No. We've had a situation of a secondary school boy whose friends were making jest of him. Yeah, whatever, innocent, mommy's boy, you don't know this, you don't know that. And to prove to his friends that, he's also a grown-up, he went to have sex. And that singular exposure, it became positive. So it's not about everybody doing it. No. It's not about it. It's about what you want to do. What you think you should do. And you stand for it. We know abstinence is difficult, it's challenging, especially in the university environment with your peers around flashing and talking about issues. But then take a stand about what you want. So there's what we call post-exposure prophylaxis, especially for those working in the healthcare system, where in the course of performing your duty, you could have exposure in terms maybe a needle stick injury. You could have splash of a blood from somebody who is positive, So that is well known. And the antiretroviral drugs are available for people who are exposed to access it. So for those of us who are going into the medical, being trained for the medical field, in the course of your training, if you get exposed in any of these ways, please make sure you go into any of the hospitals in Ibadan. Here we have UCH. Even in Jaja can actually direct you to where to go. But recently, there's also what we call sexual exposure for somebody, especially somebody who was raped, for instance, is placed on antiretroviral therapy for a period, a month, 1 month. But before that therapy commences, it's usually a test to ensure that that person truly is negative. Because if the person is positive, the regimen may be different as for somebody who is taking the drug as a prophylaxis and somebody is taking it as for treatment. And then after the treatment, you are also tested to ensure that the person is not infected. So please, if you are assaulted sexually, report immediately. This is very key. Especially, you need to report within 48 hours latest. But it's known that the earlier the treatment is started, the less the possibility of becoming infected. So don't shy away from it. Don't hide it. If you are assaulted, please go to where you will get help. Jaja is available. UCH is available. Even there's within Ibadan, we have Adeoyo Maternity, we have the later Catholic hospitals where they have antiretroviral treatment clinics all available, and they'll be ready to take care of anybody who has been sexually assaulted. So for treatment of HIV, there are so many antiretrovirus drugs are now available, and the way the drug work is that it targets one of the replicative points of the virus. It could target the entry, that's the point where the virus enters the cells, that's entry inhibitors. It could target where the virus is reverse transcribing from RNA to DNA, targeting that enzyme, or it could target the enzyme that enables integration with the host genome, and so on and so forth. So once that replicative cycle is disrupted, once the replicative cycle is disrupted, then the virus will not be able to replicate itself. So in so doing, it reduces the virus, circulating virus, to a very, very low level. In that case, the body then has the opportunity of rebuilding the cells, and then you have this individual going about their normal activity as if they were not infected. So the treatment is not a cure, but it controls the replication of the virus and gives the individual opportunity to continue as normal. So who qualifies for antiretroviral therapy? You have to be willing and ready. So it's not just once you are detected, you go and start, because people become tired of drug. It's not easy to take drug every day because the currently available antiretroviral drugs that you must take on a daily. It's like you take your hypertension drug. You are a hypertensive patient and you have to take your drug daily. I'm sure many of us have mommies or daddies who are hypertensive or aunties or uncles, and then they have to take their drug every day. After meal, they tell you, go and bring my drug case. That's the way HIV treatments are for now. It's a daily thing. So it's not something you rush into. You have to understand it, that once you start, you have to be on it. One, if you fail in using the drug as it should, then the virus can develop resistance. And in that case, the drug will no longer be active. And then the individual will start with all the opportunistic infection we have discussed in the past. But once you take your drug regularly, so you need to be willing, you need to be ready. A patient needs to be ready, you need to be willing, so that you will adhere to the regimen, and then you be compliant. Because some of the drugs you need to take with food, some you take without food, and all of that. So if you think prevention is difficult, then if you want to try the other one, it's even lots more difficult. So before we used to say stage of infection, but now there's what you call test and treat. Test and treat, as the moment you are tested positive, you are offered treatment. So that this is to help in reducing the transmission of the virus within the community. You are tested, you are offered. But remember, we also talk of willingness and readiness. So there's a lot of counseling that goes into that process, even when you'll be offered a treatment. Before now, your CD4 needs to be lower than 250. Later it was increased to 350 and then 500. Initially, the drugs available were not enough, but now we have enough drugs available for everybody who is infected to take. So there's really no need for waiting again. And then in the course of taking the drug, it controls the spread of the virus, like we discussed earlier, the public health importance of taking the antiretroviral drugs. So treatment can then be used as preventive measure. So that's where you are taking the drug to prevent transmission. So control, how do we control the virus? We must increase awareness. Everybody needs to be aware of it. Part of this course is to increase your awareness, increase your knowledge, increase your information base, so that you can go out there and inform others. There's supposed to be a ripple effect from this course. When you get to your hostel, you discuss it. When you're with your friends, your peers, you discuss, so that the information goes around, increases awareness of the populace, proper education. The course also is to provide the right information, because there's a lot of information going out there that is actually not relevant or not correct. So when you know the right information, then you go out there and pass it. And then treatment of positive people, so that those who are on virus, on ARVs, reduce viral load, and then they reduce the rates of transmission. So the role of youths in HIV prevention, treatment, and care. One is to be informed. This class or this course is providing information, but I tell you, it's not every information, because as far as HIV is concerned, every day there are new information. So we must also cultivate the habits of finding out this information ourselves. You're 100 level today. By the time you get to 200 level, there will be other information, and you're not going to take the course again. So you have to read to get yourself updated and be informed, and then act responsibly. Be responsible for yourself. Take responsibility. In this COVID era, I'm sure most of us have been receiving message from NCDC. Take responsibility. Yeah, we need to take responsibility of our health. Take responsibility of your health. I will not be infected. And when you say that I will not be infected, then you do things that will keep you negative. So take responsibility. Respect others. If you respect others, you will not rape others. If you respect others, you will not pressure others. And then show care and support. When you care for somebody who is positive, the person can only reciprocate care and love by ensuring that you also don't become infected. But when we stigmatize and discriminate because somebody is positive, then we are encouraging the spread. So those of us who are youths, we have a lot to play to ensure that this virus is controlled. Yeah, you interact with yourselves a lot, and you have many more years to go than some of us. You have many more years ahead of you. You have a lot of social media that you interact with. You have a lot of friends, and you can use each of these medium to pass information and correct those misinformation that are being spread around. So in conclusion, a comprehensive HIV intervention program is very, very important. You must be informed, must know your status. If you are positive, go on treatment. If you're negative, remain negative by maintaining a positive behavior. We've talked about the modes of transmission, the modes of prevention, the methods of misprevention, ensuring that we maintain that. Stigma and discrimination is very, very important, and we must not be found, or we must not take part in discriminating against those who are HIV important. And of course, political will. There must be a strong political will of a nation to control this. And we must talk of gender inequality and promoting human rights. Talk of if it's a male and a female, issue about rape, issue about peer pressure, and then the drugs must be available, especially when I talk of mother-to-child transmission and all of that. So, do you know your status? That's my question for each and every one of you. Do you know your HIV status? If you don't know your status, then please go for a test. You can access HIV tests for free in almost all the government hospitals. You can access it for free. If you go to Jaja, you get it for free. You come to virology and UCH, you will get it for free. You go to Adeoyo, you get it for free. Any of these government, state or federal government owned hospitals, we do HIV tests for free. So make sure you know your status. If you know your status, when was the last time you tested? Have you been exposed after then? If you are negative, ensure that you remain negative by doing the things that will keep you negative. If you're positive, please, there is medication that can help you to live a life normally without infections that will weigh you down. So please know your status and protect yourself even as you protect others around you. Thank you. I hope we're able to meet the objective of the class. I think so, to my own understanding, I think. But if you think the objective was not met, please send a question to your class tutor. And if you have any question at all, send it to your class or group tutor who will address it. Thank you again, and have a blessed day. Bye.